Hi everyone, my name is Mankirat Gujral.
And I'm Rachel Carson.
And we are the co-hosts of the Muscle Health Research Center, also known as the MHRC Podcast series
at York University Faculty of Health. On this podcast, we interview students, professors, and industry partners who bring unique and valuable insights. From cutting-edge scientific discoveries to behind-the-scenes experiences in the lab, we explore the work and the people driving innovation in their fields.
Our goal is to highlight not only the science, but the passion, challenges, and the curiosity that shape the future of human health. Whether you're a trainee, a researcher, or simply someone curious about the science of movement, you're in the right place.
All right, let's dive into today's podcast.
Hi, everyone. Welcome back to another podcast episode of the Muscle Health Research Center. I'm our co-host, Mankirat, and we have Rachel behind the scenes. Today, we have a very special guest with us, Dr. Michael Paris. How are you doing?
I'm great. Thanks for having me. How are you?
I'm good too. We're so grateful to have you here today. So before jumping into the questions, I'm just going to read out a short bio. Michael Paris joined the School of Kinesiology and Health Science as an assistant professor of rehabilitation and human muscle performance. He completed his graduate work in the Department of Kinesiology at the University of Waterloo, followed by a postdoctoral fellowship in the School of Kinesiology at the University of Western Ontario. His current research interests are focused on understanding the neuromuscular mechanisms controlling the generation of skeletal muscle force, with an emphasis on exploring age-related adaptations. He utilizes a variety of neurophysical techniques to probe the human neuromuscular system under both voluntary and involuntary contractions. At York University, his research program will broaden to explore exercise-related strategies to limit the progression of age-related weakness and loss of muscle mass. Perfect. Awesome. So I have given our audience a little bit background about your research, but could you just start off by introducing your current research and the key questions that drive your work?
Yeah, of course. I guess really broadly, our lab is really interested in everything to do with the neural control of movement. So essentially how the brain and spinal cord integrate all of these different processes to produce actionable, goal-oriented movements. I use the word movement quite lightly because oftentimes many of the movements we study end up being isometric in that there's actual no movement, but really to better understand the determinants of force control, because ultimately we are interested in that end organ, the muscle, and how it produces force. So we study it from a broad range of lenses, with perhaps the major focus being in that age-related adaptations. To really try and better understand that development and the progression of sarcopenia, which is that age-related loss of skeletal muscle mass and strength and function. Better to try and perhaps understand the mechanisms of how that's developing in an integrative human system, but also, at least in the longer term, to try and perhaps develop some interventions, not develop interventions, but sort of test different interventions to see if they can perhaps mitigate or actually even reverse some of those age-related processes. So we're really interested in trying to, one intervention is obviously exercise-related, and in particular, though, trying to develop powerful movements that really focus on high velocity contractions, because that is what's really impaired with older adults, more so than just strength. It's actually powerful movements that are particularly troublesome for older adults, and that's more related to their functional capacity. So that's broadly sort of what we're interested in. We're focusing a lot of our research on hand function right now, but we can chat more about that perhaps.
Okay, interesting. And what type of gaps in the literature are you mainly trying to address?
Yeah, so one of the big things we're trying to understand right now, and actually relates to the hand function thing I just mentioned, is there is a surprisingly strong amount of literature supporting the idea that your maximal hand grip strength, so how hard you can squeeze with all 4 fingers, is really well related to someone's overall health status. And this is observed across aged populations and pretty much most clinical diseased cohorts that have been studied. Cancer, diabetes, any sort of lung impairments like COPD. People with worse hand grip function or strength have worse clinical outcomes, a higher risk of mortality, all these deleterious outcomes. And we don't really understand why. Like it's very clear that there's this association because it's been replicated numerous times, and it's quite a strong predictive factor, surprisingly strong actually. And we don't understand why. So a lot of the research we're doing right now is developing tools and methods that we can move away from just looking at these associations, and we can start trying to better understand what are the determinants of someone's peak grip strength. Is it the size of the muscle that's important? Mm-hmm. Does it have to do with the health of the connective tissue of those long finger flexors? Is it your brain's ability to activate those muscles that might be more important or indicative of someone's peak grip strength? So a lot of the stuff we're doing right now, at least in young, healthy adults, is trying to develop those tools to understand those basic mechanisms with the intention of then sort of applying it to older adults to try and see if we can maybe better identify those with poorer function and maybe we can intervene.
So essentially first trying to understand the mechanisms and then creating appropriate interventions to help people to gain more hand strip strength.
Yeah, I don't know if it's so strange because it's like if we improve someone's hand grip strength, I don't think that's necessarily going to improve their overall health status, right? We kind of have this relationship in the fact that we know if people with poor grip strength have poor outcomes, but if we improve someone's grip strength, I don't think that necessarily might improve their health outcomes. Okay. Whereas if we improve their health status, maybe something we can chat about maybe is like the cognitive status. Would that improve their grip strength? Perhaps. So we may have like not a bi-directional relationship there, but that is very unclear in the literature right now. We see the associations at baseline, but we don't really understand that relationship very well. And that's kind of where I'm trying to push our lab towards at the moment.
It's interesting. I think that makes it more valuable too because there isn't concrete data available. So, and that's the point of research itself. You do work about things that are not clear as
exactly.
we get. Perfect. And why do you think this work really feels important or timely in today's day and age?
Yeah, it's so these associations between grip strength and clinical populations, I mean, they've been around for decades now. It's been well established because grip strength is so ubiquitous in the research literature because it's very easy to do. Yeah. But I think with how quickly over the next, let's say, 20 to 30 years, our proportion of older adults over the age of 65 and even the most rapidly growing population, those above 80 years of age, is going to exponentially grow. And so developing these tools to at least start to identify those who may need some health intervention to maybe mitigate some of those consequences that's going to follow this development of sarcopenia. So sort of developing those tools that are clinically available, right? Because we can do all these fancy measurements in the lab, but a clinician is not going to want to perform those because it's costly and may not be that effective. So we're really trying to find ways using currently available tools because of this rapidly growing population. Okay.
That's interesting. Thank you for sharing that with us. Now that brings us to another question. Can you speak to so now we're going to take the direction in another way. Can you speak to your decision to pursue and remain in academia rather than transitioning into the industry? Because there are a lot of people who might be thinking of that.
Yeah, absolutely. And that's a very important decision as you're moving throughout your undergrad to your graduate studies, determining what you kind of enjoy. out of my undergrad, I had no idea what I wanted to do. Like, I was kind of toying between trying to look for just a job out of I did my undergrad in kin at McMaster, and so I was toying between either just looking for a job or applying to professional school. I'd always enjoyed school, the process of learning, but never really applied myself very much. I mean, I went to university to play rugby. That was my main. That was the main reason I went out of high school. So I never really had a clear goal in mind. So out of my undergrad, on a whim, because I kind of enjoyed the process of learning, I decided to do my master's. Really no rhyme or reason, if I'm being completely honest. It just seemed like avoiding reality even a little bit longer. And so I started my master's, and I was very fortunate to have a fantastic advisor, Dr. Marina Mortzakis at the University of Waterloo. And she really gave me a lot of freedom in my master's, even early on too in my master's. So she really let me develop projects that I was interested in, and that probably was the key hook for me. Being able to take an idea from just an idea in my head to following through a full project, including reading literature, ethics, data collection, analysis, to actually writing the paper. Just that entire process of having this meaningful publication at the end of it was really impactful for me early on, because I felt like I wasn't given the project. I really was involved in establishing that project from early on. And so, to be honest, I never even, this is probably not that helpful to many listeners, but I never even considered industry as an option. As soon as I had that first option of exploring my ideas, I was kind of hooked, because I really enjoyed that whole process. And so that continued me on from my master's to my PhD and even into my postdoc. I always had that goal in mind of staying in academia. So unfortunately, I can't speak too much on that was a draw to stay in academia more so than going into industry. It was the intellectual freedom, I would say.
Yeah. Interesting. And the research that you did in your undergrad and your PhD, did it overlap with the type of research that you're doing right now?
To an extent. So all the work I did in my master's and my PhD, I didn't do much in my undergrad. I was just I did a little bit of volunteering in Stuart Phillips's lab in protein metabolism. But all the work in my master's and PhD was focused on body composition assessment. It was focused on aged adults, and that's where that aging perspective really came from. Trying to better understand how muscle mass influences strength and function. But the neuromuscular side of things and focusing on grip strength and more functional status rather than just the size of the tissue, that really developed more in my postdoc. So I'm trying to now merge those two worlds together, where it was sort of the imaging side where you're looking at the size and quality of the muscle, which historically the sarcopenia literature is mostly focused on. Yeah. And now I'm trying to merge that more with the neural control of the actual muscle, because ultimately force is mutually dependent on both the tissue, the muscle, but also the ability to control and activate that muscle. And so trying to bridge those two worlds.
The brain and the muscle connection.
Exactly, right? That mind-muscle connection is really important.
Interesting. And I know you mentioned a bit of this before, but what pivotal moments or consideration kind of shaped your choice of going into academia, and how did you weigh factors like intellectual freedom, impact, job stability, which is a big thing, and work-life balance when you were comparing the two paths?
Yeah. So I did speak on the intellectual freedom. That definitely that's a main driver, and still is, about why I enjoy working in academia so much. Is I can really, if I have a new interest, I can really kind of, as long as there's students that are willing and interested, we can really kind of begin to explore, and funding to explore new areas. Impact was another big one early on for me as well, because Marina, I really give a lot of credit to her, because she really gave me a lot of opportunities early on, in which she was involved in a collaborative project with this multi-center work in the intensive care unit, where they were studying the effects of muscle depletion on outcomes. And so they were using ultrasound, which is a technique I learned a lot about with under Marina. And so very early on, she involved me in this highly collaborative, very impactful, Canada-wide, and in fact, it was international. There was so many sites in the USA as well that they collected this multi-center trial looking at muscle depletion in critical illness survivors. Really impactful publication early on, and so, and still, like, I still followed this area, and just to see a lot of clinicians and people in clinical settings interested in that work and actually seeing like a meaningful impact was very motivating early on.
Yeah.
The work I'm doing now in terms of like the basic mechanisms of hand grip, nobody cares about. But I can see that eventually I could see the impact later on. And so I kind of worry actually in that a lot of like the students that are coming into my lab currently is that like, am I giving them more impactful enough studies to really generate that spark that I had early on? And I guess it's just a timing thing.
Yeah.
Because I do think it's quite important to see the impact of your work early on.
That's very true.
Because it really helps motivate you to choose one area over the other.
That's true. Yeah.
The job stability one's a tough one, though. And I think I'll end up speaking on it later. But because the bar's set right at the very end for academia, in which you need to go through all of your training, your master's, your PhD, postdoc.
Very lengthy process.
It's very lengthy, very tedious, and it's all doable, though, right?
Yeah.
But the hardest part is finding an academic job at the end.
Yeah.
Whereas something with
and there's
industry,
so many few of them.
and there's so few of them, and it's very competitive. Whereas something with industry, you can do all of the training and get all of the skills from a master's or a PhD, and there's just so much more opportunity in industry. You may not have as much intellectual freedom, but it really depends on the position, because there are certain industry positions that you do get to do research, maybe not exactly as much freedom, but certainly aspects to explore. And so I think that's probably the greatest balance, is finding a job and the security of it in academia being very challenging, but you get a lot of freedom, versus if you go industry, you're perhaps easier to get a job, but maybe not as much freedom. And that's how I view it, as a bit of a trade-off, I guess.
Yeah. I think the point where you said about the impact, I think that's very important for like master students as a whole, and deciding if they want to do a PhD, because master's is only like 2 years, and if you're working with human participants, sometimes it can be very hard to actually recruit all the participants, and the publication can take a lot more longer than anticipated, and they might not see the result right then. So, if someone wants to do a PhD, they really need to be dedicated enough to kind of delay the gratification process.
Yeah, absolutely. The whole, I find academia, you get really, it goes in swings, right? You just get a publication, you maybe get an award at a conference, and you get this very great feeling, like a very high.
I deserve to be here.
Yeah, exactly. And it feels great. And then you realize that took 2 years of your life to reach that point, right? And there's not much to show for it leading up to that 2 years, because it all comes at the end when you have that final product. I mean, you're learning so much, and it's that process of learning that's inevitably more valuable than the ultimate publication, because it's going to set you up for a whole bunch of different future opportunities. But to see the impact, it takes time, and you need kind of perspective. You need to be away from it for a few years before you really perhaps appreciate it.
No, for sure. But thank you so much for sharing that with us. I know a lot of people are still kind of deciding like, is academia good for me, or should I go into the industry? And then it really depends on what you want in life, what type of freedom that you want, how you want to deal with things, what type of impact you want to have overall. So thank you for sharing those important factors with us. Now on to our third question. So many students are also really interested in getting involved in research, and how do you think a student can stand out when approaching a professor?
Yeah, it's tough, especially when we're in the kin department. It's a huge department, especially as an undergraduate. I think it's a little bit easier as a grad student. I'll speak to, I guess, an undergrad component first. The cold email is difficult because we get a lot of those emails weekly, and I find it near impossible to sort through who is more dedicated or who's more interested in. I don't necessarily look at grades or features like that because I think they only tell so much of the story and may not really tell who's going to be invested. Because ultimately, people that I want joining our lab is people who are invested and interested. You don't have to have the best grades. It's just people who are willing to put in the time and effort, because that's really the key driver, I think, for a successful thesis is it just takes time and effort. And so how to stand out, speaking in person, I find, like after class, before class, just if there's office hours, attending regularly, just getting a face to a name is so important, so that when that email comes in saying, yes, hey, I'm interested in, if there's an opportunity in your lab, then at least I have that connection already established. I'm much more willing to kind of, I don't want to say vet them, but like bring them into the lab and just chat with them a little bit more to see if they're interested in. The cold email is very difficult.
Yeah.
For grad students, chatting at conferences is by far the best. Those social events are so important.
Yeah.
Either chatting at like a poster or asking a question during a presentation, but then really trying to engage them at more social events, I would say, is the best opportunity if you're really interested in working with them.
Yeah, that's where the networking really plays a role.
It's 50% of it is just networking at those social events.
You just have to be at the right place at the right time, because there's very few of these positions available. And if you're just there and there's a position available, then, you have a higher likelihood of getting it.
Absolutely.
So, yeah. Perfect. And is there a difference between a student who's just simply enthusiastic about learning and one who's, truly ready to contribute? And how do you think that students can bridge that gap?
Yeah, this is a tough one. I think it comes down to the lab, I think, ultimately, because I know some labs where they are looking for particular skills. Like, for example, Andrea Joss's lab, right? They do a lot of training interventions. And so they may be looking for individuals with experience in strength and conditioning. And there's like transferable skills, and they're going to, that's very helpful. Whereas many other labs, like I can speak for ourselves, is so niche that it's almost, as an undergrad coming out with very little lab experience, it's almost impossible to be, I would say, ready to participate in our lab, because there's so much lab-specific training that needs to happen that I really wouldn't expect. Even if you had past lab experiences in other labs, I really wouldn't expect any student to be able to contribute immediately. It's going to be a long process of learning the lab and all of our different techniques. So I actually think being enthusiastic and making that connection early is the most important factor. And I'd be, if I'm able and willing to bring in a student, I've already committed to that student, and I'm going to be there helping them train and learning all of the skills necessary to do the work that we're hoping to do. There's other things. If you knew like statistical processes like R, that's certainly helpful. Practical skills like that can be beneficial, but again, I'm not expecting students to have a really clear understanding of statistics, right? I'm going to help them with that process because it just takes time. Yeah,
for sure. And I guess overall, like a student can look really perfect on paper with like amazing grades, but how much do they actually know like in person? So I think that also like really matters.
It does, yeah. If they're if they're willing to put in the time and effort, I'm more than happy to take a student with less than stellar grades if they're dedicated, sort of thing.
And I think that's the thing with grad school too. It's like in grad school, you're not only expected to take courses and learn, but you're expected to create new knowledge.
Absolutely.
And you can't do that if you're not enthusiastic about things, if you're not really into the learning process.
Yeah, 100%. Because throughout your undergrad, the learning process is, I would say 90% is passive, right?
Yeah.
You're given information that you may need to read on your own, but you're given that information.
For sure.
Grad school, you have to seek that information out. And that I find where it takes enthusiasm and interest in the topics you're actually researching, or else you're just going to keep pushing it off, because it can be very tedious to scroll through the literature because it's very dense at times. But it's so important to build that knowledge base and determine, like, is this a new and novel idea?
Yeah. For sure. And what type of common mistakes do you see students making when they reach out to professors or when they're just getting started in a lab that they might not even be aware of?
Yeah, I think it's a bit of a fine balance, but I think one issue that some students may run into is not knowing when to seek assistance.
Yeah.
And so I think it's very important that, this might come off wrong, but that you struggle a bit and that because it's part of the learning process, right? And if you're intending to stay in academia or really gain a lot out of this master's or PhD process, it should be a struggle at times to know that you're actually going through that learning process. But it's a bit of a fine balance in which you can sort of spin your wheels on one process or one aspect for a long time and not really gain much traction, whereas you could perhaps seek out assistance from either your advisor or a collaborator that maybe can point you in the right direction, not give you the answer, but just help you kind of get your wheels unstuck, as it were. And so it's a hard thing to balance in terms of like trying to do it yourself and learning through that process versus seeking a little bit of guidance earlier on. And so it's probably best to seek that guidance early on to get a bit of a direction in one way or the other, and then spin your wheels a bit to really ensure that you understand that whatever it is, that process you're working on.
Yeah. And what would you say to the students who feel kind of afraid to ask their supervisors for help because they don't want to come across as like stupid? I know that a lot of students feel that way. They're like, no, I don't want to ask. Like, then they're going to think that I don't know something. And then, then they're not going to keep me on this project because they're going to think that I'm incompetent. Like, how would students kind of deal with this mindset? And what's the right way to ask your supervisor questions?
Yeah, that's a great question. I think you have to you just need to get over that barrier of asking questions. Asking questions during conferences and presentations, it's important. They're not going to think, I'm sure there are some supervisors that maybe have more toxic lab environment, and maybe that is an issue, but for the 90% of the people I think that you'll be working for, they'll assist you in any way they can, and they're not going to think differently or look down on you if you don't understand one thing. I don't expect any students coming in to understand any of the processes we're doing. So asking questions early on when you don't understand something is critical. It's better to ask a question early on when you don't understand than pretend like you understand and wait 6 months later when you perhaps should know it by then. So getting over that fear early on. How to ask your professor about that? I don't know. I'm very laid back and very casual. And so I'm in the lab more or less like every other day. So I'm very hands-on at the moment. So I'm kind of the one still, because we're so new, I would say. Like, we just have our first cohort of master's students starting their projects now. So I'm the one that's translating or transferring all that knowledge to our new grad students. There's not like a continuum of knowledge transfer yet. And so, I don't know. To me, it's always been very natural. You just, like, if you're in the lab and your supervisor's there, you just kind of, hey, can you come over here? I'm having this problem. Then you kind of work through it together. I don't think it needs to be a formal process per se, depending on, I guess, if it's more of a lab issue or like a technical thing, or more of like a longer term goal. Like maybe like you're curious, like you want to go to a PhD in this lab. Like, well, how will I go about that? Well, then you may want to set up a more of an individual meeting rather than just like a quick chat in the lab.
Yeah. Okay. Yeah, thank you so much for sharing that, because I know a lot of like students are curious about that, and getting a professor's like perspective on it could be really helpful for them.
Yeah, absolutely. Again, it's just like the pointing in the right direction to at least gain a bit of understanding early on, and then you can let them explore.
Yeah, for sure. And then let's get back to the academia versus industry point.
Yep.
So academia is, of course, a very long road to travel before becoming a professor. And were there any moments where you doubted whether this journey is worth for you, or if it's worth continuing? And how did you navigate that mindset?
Yeah, it's there's too many to really there's honestly too many that talked about. Like, you know, there's a lot of highs in terms of like, oh, I got a publication, got a grant. There are a lot of challenges as well, and like there can be some very mentally challenging times, emotionally, and very, very. I'd say the biggest thing is the uncertainty of it all. And I always found that uncertainty the most during the transitions when I went from undergrad to master's. Maybe not so master's to PhD, because I stayed in the same lab, and so that was perhaps a comfortable transition for me. But certainly PhD to postdoc, and then postdoc to a faculty position, right? It's the uncertainty of those transitions I always found the most challenging. One example was when I graduated my PhD in midst of COVID, and I think it was May of 2021 is when I officially defended. And I actually didn't have anything. I'd been chatting with a postdoc advisor, Charles Rice at Western University, where I ended up actually going. But up until that point, there was nothing concrete and set in stone. So I just graduated, and I really didn't have anything lined up because I didn't get my NSERC PDF funding. Like I didn't receive it that year. And so I had also applied to this internal one, but we hadn't heard back yet. So that was probably the most challenging time, was when I had just graduated my PhD. You think that would be a big celebration, and here I was, like I had no idea what I was going to do next, because I was so focused on staying in academia. But it kind of looked like the end of the road, as it were, and that there really wasn't the next opportunity. Luckily, about a month and a half later, I ended up getting this internal fellowship at Western, which then led to an NSERC PDF, and everything worked out, thankfully. But it was very, very challenging time. And what really got it through me was obviously like your personal network, I think is really helpful. Specifically my girlfriend at the time, my now wife, was super supportive. And in terms of my professional network, Marina, my PhD advisor, was super helpful in that she actually kept me on for that intern time as sort of like a research assistant, like lab manager, just to help finish off a couple projects. So yes, many challenges, too many to list, but though that's probably the biggest one, and it's all to do with the uncertainty for me, at least personally, and comes back to your network of people, right? Establishing those support networks throughout your master's and PhD, so that when you run into those challenging times, you can rely on them. You know, maybe there is a postdoc opportunity and I'm just unaware of it, and so maybe your network can help you set you up for that interview with that potential option, or maybe there is like this small pool of funding that they can tide you over for a couple months while you figure things out. So I think it was my network that saved me, right? That was super helpful.
For sure. And I think it's just like a normal person would expect that, oh, you know, you have a PhD, like job offers would be coming your door like every second. But in reality, like that's not true. Even if you have a PhD, you're still fighting for positions. And it kind of, it just seems kind of like unfair at times. It's like, oh, like you have a PhD, you know, you should be able to get such like a good, like high paying job like right then. But
no, it's very competitive still.
Yeah.
Academia even more so, very competitive because there's so few positions.
Yeah.
And even in industry, it's difficult, right? And that's the bars that, like, I always like, you know, where's the bar of entry? It's not saying it's easy, but it's generally not too difficult to get accepted into a master's or accepted into a PhD.
Yeah.
But you need to keep in mind that, yes, it's challenging and there's lots of highs and lows throughout, but really I think the bar is at the end. You've just graduated, but what are you going to do with that PhD? And unfortunately for academia, it's always at the end. Like the hardest part is landing that final position versus something like professional school. Very difficult to get into, but once if you get in, you can generally manage it, and then there's generally positions available after. So it's difficult to make that determination.
For sure. And then looking back, what do you wish someone had told you earlier that you would pass on to students today?
Probably to enjoy the process more than I did. You learn so much. Again, undergrad's great. You learn a lot. Like, I just don't find you get a lot of opportunity to really demonstrate yourself in an undergrad, right? Because it's very rigid. It's very didactic in a sense. Like, I'm sure there's some courses where you get more options to explore, like the research and independent studies, but just being very didactic as an undergrad program, you don't get a lot of opportunities to really explore your interests or demonstrate your knowledge. And so I found graduate studies, and I'll speak to a graduate studies perspective, is such a fantastic learning opportunity. There's never going to be another time in your career where you have as much time and freedom as you do in your master's and PhD. I know it might seem like there's a lot, and there is a lot to get through, but you have the opportunity to explore whatever you're interested in without having to worry about all these other things, right? As soon as you get, like, if you stay in academia or you enter industry, there's always going to be these other things pulling away from your time, versus as a master's and PhD student, you get to take your comprehensive exams as an example, right? You get to pick potentially topics that you might be very interested in and really get to explore them and learn. One of the things I did during my PhD that has been immensely impactful was I learned how to code in Python. Something that is an idea I had for a project that required coding. I had no idea what coding was prior to this. Never took computer science before, but I had the time as a PhD student to learn this skill, and it has been one of the most useful skills I've continued on with my postdoc and even into my faculty position. That's really opened up the opportunity for all these additional ideas and projects I wouldn't have otherwise had, because I had the time as a PhD student to learn it. So really cherish that time and explore what you're interested in.
Okay, awesome. Awesome. Thank you so much. This wraps up another podcast episode. We're so grateful to have you here, Dr. Michael Paris. I'm your host, Mankirat, signing off, and we have Rachel behind the scenes. See you next time.
That wraps up today's episode of the MHRC Podcast.
Thank you so much for joining us today, and a special thank you to our guests for sharing their insights and experiences.
If you enjoyed this episode, be sure to follow us on Instagram, LinkedIn, Facebook, and YouTube so you never miss future conversations.
And to learn more about the Muscle Health Research Center and the work happening here at York University, including our upcoming events and resources, check out our channels and stay connected.
Thanks for listening, and we'll see you in the next episode.